Okay, a very warm welcome once again to everyone today. Thank you for joining us today. Our program today is organized by Innovex, and we're thankful for their support today. And for today's program, the first part will be a practical guide to fans in RIRS with a semi-live surgery segment. And we'll then discuss how we can push boundaries with fans and the residual challenges that still remain. We will then do a Q&A at the end. If you have any questions, feel free to also type it in the chat and we can answer it at the end of the session. So a very warm welcome. My name is Dr. Tan Yi-Chuan. I'm a urologist at the National University Health System in Singapore. And without further ado, we'll start with our first segment. And this is a practical guide that we actually created at the start of this year. And greetings from Singapore, where I work at both the National University Hospital as well as Ng Teng Fong General Hospital. And at Ng Teng Fong General Hospital, I work in a dynamic endourology team that includes Dr. Vineet Gauha, who is no stranger to us when it comes to suction in endourology. And we're very privileged to have the opportunity to be able to host this webinar today. So in today's era, I would like to ask, is anyone still using a floor broom or to sweep dust, or are you using a vacuum cleaner? In fact, someone has actually invented a combination broom that you can actually break up the dust and then suction the dust up. So the aims of this practical guide are as such. RIRS with fans has rapidly gained popularity worldwide, but there remains a lack of practical guidance on its usage. And this guide really represents the first in the world practical guide to fans, and we thank Innovex for the opportunity to create this. We also want to share best practices and techniques from our real life experience. And we also will share some tips and tricks to optimize the efficiency and improve outcomes when using fans in RIRS. There is a wide variation of experience among our audience today. I seek your understanding if there are some parts that may be a little bit too basic for you if you are a more senior urologist joining us today. So there are actually 8 modules to this guide that some of you may have seen through your local distributor globally. And these include the introduction, RIRS planning, knowing your fans, your ureteroscope, setting up for the RIRS, and performing RIRS with fans. And we'll also talk about stone extraction as well as the exit strategy. So today's guide is we're actually highlighting some of the more salient features, and the guide actually contains a lot more information, but because of the constraints of time, and I also want to present some videos to actually share some semi-live surgery. So we're actually going to condense things a little bit. So the role of suction in RIRS, the name fans, flexible and navigable access sheath, actually came back in 2023. And this was actually coined by Dr. Vineet in 2023 to standardize the term for these negative pressure access sheaths which were flexible. And in this first worldwide study, we collaborated with Prof. Oliver Traxler in France to demonstrate the utility of fans. So since then, a lot of us, I think, have moved on from the traditional sheath to the fan sheath that we see today. So what are the benefits of fans? In many multi-center trials, as well as RCT, we can actually see that there are actually 8 main things that fans actually helps us to do better. So firstly, it reduces intrarenal pressure. It improves the stone-free rate, reduces infective complications, improves our vision, reduces heat, lowers reintervention rate as well as cost, and it also helps us to extend our uptime beyond traditional safety limits and improves our ability to treat larger stones as well as do same-sitting bilateral RIRS. In Module 2, we're actually going to look at planning for the RIRS. So firstly, in terms of CT imaging, there are 3 main things that we actually have to look at. Firstly, the stone characteristics. We have to look at the collecting system, and we need to always have a plan B. For stone characteristics, this is what I would suggest. Always assess the number of stones, the location of the stones, dimensions of the stones, as well as do a volume calculation, whatever program you're using. I like to use the simple ellipsoid formula to calculate the stone volume. Look at the Hounsfield unit, as well as to assess whether the stones are unilateral or bilateral. The collecting system is very important as well. So as you can see in this picture, it's actually a non-contrast film adjacent to a delayed phase. So I always scroll both films together in a synchronized fashion to actually see how the stone actually connects. I will also look at the infundibular pelvic angles, the infundibular width and length, although we know that it is not as accurate compared to actual RPG, but it does give us some clue whether we're going to run into some difficulty. We also want to look at the collateral diverticular, if any, or stenosis infundibuli, which may predict challenges during the RIRS. There may be other patients with abnormalities such as duplex systems or strictures, which we really should be aware of before we start. I also typically assess the ureteric length for the DJ stent insertion, as well as to also measure the fan's length, as we'll talk about later. So in terms of plan B, always prepare for a conversion to PCNL if retrograde access fails. And with that, you would have your PCNL puncture considerations and also consider whether you need to combine your RIRS with a antegrade ECRS approach. For the patient, this is typically how I prepare the patient. I would counsel the patient according to their individual characteristics based on their circumstances, as well as their their CT scans. I would do blood and urine tests, get an anesthetist to review. For infection stones, I typically treat with antibiotics up to the surgery. And for all my primary RIRS cases now, I typically give alpha blockers for 2 weeks to improve the success rate of the primary RIRS. For the equipment, it is important to plan. So while standing there, think about what guide wires, ureteric catheters you want to use, what irrigation systems, what fans and flexible ureteroscope you're going to use, as well as your laser energy, imaging, and suction systems. And we'll go through these one at a time. So for the irrigation systems, there's a wide variation of practice globally. Some of us are using gravity bags, some are using pressure bags, automated irrigation pumps like the EndoFlow or the EndoMat. There are hand pumps that are combined. And we also now increasingly have some intelligent suction and irrigation systems. For the fans, there are many in the market currently, but really consider what length of fans you want, and we will discuss this later. What size, again, we'll discuss this later. And also, after you've had a feel of some of these different manufacturers, you kind of have an idea how flexible the fans are, whether you like the Y suction design, whether you like a thumb slider or not. And the design and ergonomics also plays a part, much like when we go and buy a car, you want to have something that you really like to use. In terms of the flexible ureteroscope, it's important to consider the size of the flexible ureteroscope. Some manufacturers have multiple sizes of the scopes. Consider whether it gives you good vision, the flexibility and the strength of the ureteroscope, the working channel position, which may come in important in certain cases, and also the design and ergonomics and whether there's a locking mechanism, if that's something you prefer. In terms of the laser energy, some of us may have one laser machine, some may have 2 or 3 in our center, but really think about whether you're using a Homium machine, and increasingly nowadays we have modulated Homium machines such as the Magneto, for example, and also the other things would be TFL, if you're using a TFL laser or thulium yak laser. Consider whether you're using reusable or single-use fibers and what fiber size you use. Typically, I use a 200 for IRRS because I find that the 150 is a little bit thin for handling. Consider your laser settings, which we'll talk about later. If there's an opportunity to set the pulse width, do set it, and also consider laser protective equipment. For intraoperative imaging, some of us are doing fluoroscopy-free RIRS, and some of us are doing conventional. So typically, I would do conventional RIRS with fluoroscopy because of medical legal purposes as well as for documentation. For suction systems, there are many out there, and there can be surgical suction pump machines, like the one that you see on the top left. There can be wall suction machines, floor suction machines, intelligent suction and irrigation systems, and also consider whether you need your suction collection bottle for with you. For day of surgery planning, it's important to take note of a few things. I like to sequence my operative list such that I put the more difficult cases at the start. I will also cater adequate time based on my experience in terms of the stone size, how long I think I'll need, and also have a word with the anesthetist in terms of the type of anesthesia. Most of us would do it under general anesthesia. There are some cases whereby we would do under regional anesthesia, and in certain cases certain places whereby the anesthetic support may be limited, even local local anesthesia RIRS has been performed before. If you're doing under GA, speak to an anesthetist about paralysis for respiratory control if you'd like, and also induction antibiotics. And if you're starting out with a new device, consider whether you need vendor support on the day of the surgery. Okay, so we'll go on to the fans anatomy and also choosing the length of fans and how I would share how do I choose among the fans that are in the market. So in terms of the fans anatomy, this is the Innovex fans. There's a pressure control vent that actually controls the suction pressure when occluded. And there's a thumb slider to actually cover this vent, and it can be detached based on surgeon preference. There's an oblique suction port, and some of the older models of the Sheath, the pressure control vent and the slider tent was on the suction port, but now it has actually been converted to the main stem, which I'll show in a bit. The other thing would be there's a uniquely designed air seal cap, which actually very nicely prevents fluid leak and prevents accidental scope withdrawal. So in terms of the anatomy, there's also the inner obturator or stellate, whichever you want to call it, and it's a secure one-click attachment for easy removal and ease of use. And once the obturator is removed, the fans is immediately ready for use without additional attachment of suction caps or screwing on the cap of the port. The other thing would be the atraumatic tapered tip, which is not excessively long because we don't want to cause things like medial perforation, and it can prevent trauma from over-insertion. In terms of the outer sheath, there is usually a 40 or 50 centimeter working length with a distal 10 centimeter flexible tip, and there's a king-resistant hydrophilic coating reinforced with stainless steel. So it gives a good balance of stability, strength, but yet reducing friction and irritation to the ureter. The tip of the fans, as you can see, is a slightly different color. It is reinforced to prevent deformation, but yet maintaining tip flexibility to reduce mucosal trauma and improve access to calyces. So in terms of the fan's length, generally 40 cm should suffice for most average size females and 50 centimeters for most average size males. And after positioning the fan's tip in the renal pelvis, the working length outside the urethral meatus should be around 5 to 10 centimeters, and we'll show it in the semi-live surgery later. For the fan's length, if it's too short, telescoping and trauma to the glans penis can happen when we actually push onto the penis. And then overly long fans can be quite irritating because there's too much mobility, there's too much redundant length, and there's too much effort to try to withdraw for the additional length. And it can also cause accidental dislodgement because of the weight of the suction tubing on the tip of the fans. So in terms of choosing fans size, I think this is quite a hot topic that most people would ask. There are four things that I consider. Firstly, the size of the ureteroscope, and that will